Talofa lava, maloelele, bulavanaka, whakalofa lahi atu, ulawhale mai. Warm Pacific greetings to you all. I've been asked to talk to you about engaging Pacific patients. I hope that you're already aware that the rates of Hep B for some Pacific ethnic groups is 10 times higher than the general population. This means that working in the Hep B population, working with Hep B patients, you're more likely to come across Pacific patients. And when you're working with Pacific patients, you should always think of Hep B. The most important thing to remember that is like all the different languages I just greeted you in, each Pacific Island culture is very different. Samoan culture is different from Tongan culture, which is different from Tuvalu, from Fijian, from Niuean, from the Cook Islands. Another important point to acknowledge up front right now is that there are less and less 100% blood Polynesians of anything. Like myself, many have mixed heritage. My father is Samoan, my mother Pākehā, and I was brought up in Whakatane speaking Te Reo Māori in English. My husband is Tongan, my cousins are Cook Island, Niuean, New Zealand Māori. My nieces and nephews add Fijian and Australian Aboriginal to our mix, which also includes Irish, Swiss, American, English and Scottish. Also, New Zealand-born or raised islanders may or may not connect strongly or at all to their home culture. My New Zealand-born father understands some Samoan but is not comfortable to speak it, and he shocks his Samoan-born and raised elder sister with some of his behaviours that are not culturally appropriate. My New Zealand-born Tongan husband, the next generation, spoke Tongan at home with his parents and still speaks Tongan with his mother. He uses his language and understanding of his culture in his work every day. I point this out because if I was your patient, you might recognise my name as Tongan, and my patient file might identify Samoan as my first, main, most important statistically ethnicity, but it's not helpful to assume that I speak Tongan and or Samoan language or follow any or all of the cultural traditions. I may feel guilty or sad or angry about this and may disengage from the health professional making the assumption as I wonder what else they are assuming about me. If they are not culturally competent, I might question their competence in other areas. Their competence to be able to understand me if I am truthful about my situation, or indeed their clinical competence. When I asked Wikipedia about cultural competence, I found, quote, appropriate intercultural communication includes behaviours that suit the expectations of the specific culture, the characteristics of the situation, the level of the relationship between parties involved in the situation. It also takes into consideration one's own cultural norms and the best appropriate comfortable compromise between the different cultural norms, unquote. So it is important to know and reflect on your own cultural norms and be aware of the things that make you feel culturally uncomfortable or unsafe, so that you can approach this compromise from a known position rather than reacting in surprise. Let's deconstruct the Wikipedia statement a bit, especially around the expectations of Pacific cultures and how you might approach the situation to improve engagement. Number one, all Pacific cultures place high importance on connections between people. Families are generally very close. It is common to have many extended family members living close, perhaps in the same house, and common for them to have loud and strong opinions about how their family member, your patient, manages their health. In particular, in Tongan culture, the whahu makes decisions and directs many aspects of family life. The whahu is the oldest daughter, so my sister-in-law, who is younger than me, is the whahu of our family, and in her absence, her 15-year-old daughter, her opinion carries much weight. The New Zealand legal system may recognise an individual's right to consent from age 16, but the reality for some Tongans is that their auntie, who may not be privy to much of the education and discussion you are giving to the patient, may make the final call about engagement or adherence to management plans. Encourage your patients in their legal rights to confidentiality and into deciding what is best for them, but acknowledge, respect, and support open discussion with whoever in their family they feel the need to. Number 2, nearly all Pacific Islands were colonised. Despite the decades or centuries that have passed, there remains for many a deep distrust of anything to do with Palangi, a distrust of white man's medicine, Western health systems and processes. Be aware that for those that experienced the dawn raids of 1970s Auckland, surveillance is not a nice word. Respect their right to choose, even if you don't believe it's in their best interests. Educate and empower them to make this health system work better for them. Number 3, respect your elders. This is an extreme importance in Pacific cultures. One of my husband's cousins, aged 6 years, complained to our husband that our son, then aged 7 years, was being disrespectful and not letting him eat first because he thought he was older than our son. The instant the age difference was clarified, his behaviour changed. Be aware that if a patient perceives themselves as older than you, the expectation is that you should be respecting them as their elder. If they perceive that you are older, you hold a lot of power and they may behave very deferentially to you, including telling you what they think you want to hear rather than the truth. Number 4, personal space and bodily contact. Always ask permission or indicate your intentions before you touch someone, especially around the face and the head. On the flip side, Pacific greetings and building connections involves hugs, handshake hugs, cheek kisses, hongi. A few years back, a distinguished GP fellow was teaching my registrar group about boundaries in professional relationships. She, an older Pākehā woman, was saying she could count on one hand the number of times she had hugged a patient in her career of over 40 years. I had to point out that in my community, I had hugged and kissed a dozen patients that same morning. My teacher and I acknowledged that our practices are in different communities with different expectations. For me, culturally appropriate physical contact is essential to building therapeutic relationships and engaging with my patients. For you, be aware of the expectation and the opportunity to build relationships. Also be aware of your own expectations, comfort and safety. The compromise will be different for each situation and patient. Number 5, feeding someone and gift giving is the Pacific way of showing love and honour. If you are offered a cup of tea, food or a gift, you are being honoured. It is culturally disrespectful to refuse. On the other hand, my medical council, my college and the general medical ethics frown upon accepting gifts, etc. Be aware of the expectation and the possible disrespect. Be safe in what you accept and sincere in your apologetic refusals if it's not appropriate. Number 6, talking about sexual health and sexual practices can be confronting to many people, and always consider that many Pacific people have strong religious and cultural beliefs around sex. Before broaching this subject, build great relationships and acknowledge the possible discomfort if you want a useful and truthful exchange. Number 7, social issues affect health in Pacific communities. Transient insecure housing, especially in South Auckland, unemployment, generations of beneficiaries, generations of incarceration in contact with the justice system. Health, especially a chronic condition that has zero or few significant symptoms like Hep B, is simply not a priority sometimes. When faced with the choice of arranging transport and standing in line at either WINS to confirm emergency housing for the next 1 week, or the lab for routine 6-monthly blood tests taken for a condition that gives you no trouble on a day-to-day, I ask you what your choice would be. Please respect the prioritisation. Please assist in any way possible. Number 9, health literacy. Is it free? During our recent measles outbreak, my father became aware of a Samoan family who had not accessed immunisations because they did not know they were free and funded for their children. We may think this is impossible, but immigrants to New Zealand will not have innate knowledge of how our health system works. Ensure your patients know that Hep B immunisation for household and sexual contacts is funded. Remind them that the blood test has no cost, at least in money terms. The time and effort costs remain. And again, I ask if you can assist in overcoming these barriers in any way, please do. Every interaction you have with a patient is an opportunity to either disengage or engage that person and their family with you, your organisation, and the entire health system. It is a big responsibility. It is important, not just for this patient, but for their parents and grandparents, their children and grandchildren, their siblings, aunts, uncles, cousins, nieces, and nephews, because that's how Pacific families work. Whakawhetai, whakawalahi, whenaka wakalevu, me taka maata, maloa pito, whawhetai lava. Thank you for listening, and thank you for your efforts in our community.
Kia ora koutou. Kia ora. Talafalava, Malalali, Salam alaikum, Sat Sri Akal, Namaskar, Swadika, Ni hao, Konnichiwa. I am from Tamaki Makaurau, Auckland, and that's the Auckland of today. Look, we have been given only 10 minutes. 1 minute is about to go. 9.5 minutes left. I'll be very quick, but I think I'll be here for the whole day. If any particular components you would like to clarify, because I won't be able to touch base on lots of the details of the presentation, because there are lots of pictures, a lot of stories, but I'll give you the glimpse of things, what we do, who we are, and why we exist, and how we involve with the diverse Asian community. My friend Emalia has just mentioned Pacific as one word, but there are different cultures in Pacific, right? I realized this after living here for more than 8 years. At least it took me 7 to 8 years to realize when I visited Pacific Islands. And it is fabulous, beautiful place, beautiful place. Similarly, Asian cultures are diverse as well, within their own cultural beliefs, religious beliefs, and lots of other beliefs. Give you an example of India. After every 150 kilometer radius, the language, dialogue, food, everything else changes, right? So that will give you a depth of Asian culture. This is only India I'm talking about. But let's start with, who knows who are Asians in New Zealand? Or what's the definition of Asian? Everyone is looking at that. Look, I know the first session of the second day and the last session of every day of every conference is the toughest one, right? So I acknowledge that, I know that. So I'm not testing your knowledge at this point, but the term Asian encompasses people from vast area of Japan in the east to Afghanistan in the west. So it's huge, right? Very quick glimpse of very old statistics. 2013. We have already moved in 2000. We are going to be in 2020. The census will be hopefully out in early 2020. But just to give you a gist of things, in 2013, Asian population had grown nearly 9-fold as compared to 1986. It was less than 2%, and in 2013, it was about 12%. We have already surpassed more than 15% in New Zealand already. Nearly 80% of Asian people were born overseas. 2/3 usually lived in Auckland in 2013. So this around 22% of Aucklanders are Asians has already been surpassed. Now it is more than 25% of Asians in Auckland. Maybe a little bit more once the Chinese, followed by Indians, Filipinos, is the chronological order of the population. And that brings us in to do some work with the communities, because Asians come from different spheres of different countries, different medical systems, different social structures, different political systems. So when it comes to health, every country has a different system. Every Asian country has a different health system. In India, for example, it's kind of a shop. If you fell sick, if you're not feeling well, you won't go to GP, you go to the chemist, you go to the pharmacy and ask the pharmacist, oh, I'm not feeling well, and he will give you something. And once, after 1 week, if you still feel the same symptom, then you go to GP, knock the door, no appointment. But here, there are lots of different things. You have to make an appointment. You have to, after making an appointment, you still have to wait for more than an hour. So there are lots of things. So Asian Network is a pan-Asian community organization working for the betterment of the community's well-being and life. And we are in existence since 2002. We are not one-on-one client-based services, as all of you do, like in nursing. We are a population-based service. So we work with the population, with groups of people. We do health literacy symposiums. We do networking workshops. We publish newsletters in multilingual languages. And what we do by doing these health seminars is we bring all the key messages of health service providers and communicate them in a culturally appropriate way to the Asian community. That's what we do. Oh, yeah. Oh, have you seen this? Right. So the difference between what we do and what our GPs are busy doing, because that's their role, to keep treating patients, and then sometimes we forget about the prevention, the long-term preventative stuff. So our job is to go at the back and turn the tap off. However, we are still trying to do that. So who knows about this logo? Anyone? Nurses, come on, nurses, morning. Anyone knows about this? Ottawa Charter? Yes, 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 yes. So we follow this charter. We advocate, enable, and mediate, and we contribute towards building public health policy and create supportive environments. And how we do that? We do three major things. Oh, over there, not there. Okay. Strengthen community action, develop personal skills, and reorient health services. I think I'll be left only with 4 minutes now, 3 minutes maybe. So health promotion, our contribution, I won't go into the details, but this is what I've just explained what we do. But I'll come to the glimpses of it. So we run moms groups, parents groups, and Asian, Chinese groups, Korean groups in Auckland. There's few of the glimpses from a lot of other groups. Healthy eating, shopping smarter, physical activity. This is our annual Asian forums. We do this as well. In between the breaks, and the morning of second day, we do that. It's a good idea to do that next time. Regional network meetings we organize, and multilingual newsletters. We promote health messages and service information at various events in Auckland as well. Lantern Festival, you name the festival, we'll be there. But it's a boring topics we discuss. Come on, it's a Diwali festival and you're with the stand with some 20 brochures in different languages. Oh, who's going to come and read them? So our enthusiastic volunteers suggested us to have a balloon twister at the site, face painter on the site. So when children queue up, we talk to their parents. That's cultural competence, really. We need to know that. So again, as Emalia mentioned, Asians believe in the family whānau culture, which everyone in this room would be aware of. And, oh, sorry, this is an important slide, which flicked very quickly. Yeah. So we run some cultural competency training for practitioners as well. We did this a long time ago with one of the PHOs and School of Population Health professor, my previous professor, Dr. Samson C. He was the one who co-facilitated this with us. So there's a difference between these four terms: cultural awareness, cultural knowledge, cultural skill, and cultural encounter. So cultural awareness describes the process of becoming sensitive to interaction with other cultures, as my previous speaker said. Cultural knowledge is the process in which the health practitioner obtains a sound educational foundation. It's a little bit deeper. And the cultural skill involves the process of learning how to conduct a culturally appropriate assessment and interventions. And cultural encounter is when you do that. Actually, you're doing that. Again, beat around the bush. There are some of the slangs we have used. Non-verbal communication is extremely important for Asian clients. If you ask me any question and I'll say, oh yeah, it doesn't mean that I have understood you, right? So it may mean that I'm listening to you, right? So I'm not saying try reading the minds of the patient, but I'm just telling that these are the gestures we generally use a lot of hands, some people like I'm using today. Yes doesn't mean always yes. We may not speak loudly, like, oh, we need this, I need help, that sort of stuff. But in our Western culture, unless you ask for help, it's okay to say yes. But it's still not okay for a lot of cultures to say yes to help, although they needed help. Do not provide too much information at once. Allow the client sufficient time to respond to any queries. Use short sessions with follow-up sessions to reinforce information. And I'm still learning while working with the broader Asian community and being an Asian myself. Of course, we can't standardize Asian culture due to the vast diversity within Asian subgroups, including but not limited to family culture, socioeconomic status, rural, urban background, democratic, socialist, republic country, and all those sort of things contribute towards your cultural competence. Again, I won't go too much into the details. As you can see, pictures describes it all. But irony is the support worker in New Zealand can be seen as a servant by an Asian client. So this is one of the quotes from Geneva Health support worker who came to us and said, we work with the Geneva Health and a lot of other home-based service providers. So it is an education. Cultural competence and awareness needs to be from both sides, from every side. Asian clients needs to be culturally aware as well about New Zealand styles. It's not one way, right? So at the same time, we have to always keep, so this is what we do actually in the community. We tell them, this is New Zealand style. You have to change that thinking a little bit and try to understand New Zealand style. At the same time, we tell our New Zealand practitioners, you need to understand. So we might meet somewhere in the middle. Tradition, again, expectation is different from the family side overseas. And even if the parents are living with you, then expectations are really different. And then the new generation, New Zealand born, are taught something different in the schools. Look at your eyes, look at me, look at me. In Asian culture, we don't look into elders' eyes, right? When they are saying you something, you just bow down and listen. But here, you listen like that. And that is the difference between what is being taught in the school and what we teach at home. Same with Pacific, isn't it? Yeah. Continued, this is just grandparents wish to raise their grandchildren. Ideal, oh, sorry. Oh, it's election day. So this is not intentional. This is not Labour and National. I want to make it clear. So it was purely, my colleague gave me these couple of slides and I just used them. So this is Asian in the red and this is Western. Sorry, yeah, I just realized. My apologies. Just few points to work with the Asian clients again. Education around New Zealand health system is crucial. We are still doing this. Just to let you know that last year we ran about 55 plus health seminars in Mandarin language in Auckland. We work with more than 25 libraries in Auckland. We have a well-established network. So if you want to communicate your messages in a culturally appropriate way to the Asian community in Auckland region or any other regions, we are there for you. And it's free, especially the newsletter articles. We don't charge. I think we are the only ones who publish the newsletter, 8 pages, double-sided, colored, printed, e-copy, and we have only half a page in there for ourselves. Rest all for the other providers. So these are a few of the collaborations we have done in last couple of 2-3 years. These are the organizations we have worked with in the past. And only when all contribute their firewood can build up a strong fire. We all have a role to play. So I will just stop here and ask for any comments, suggestions, or questions from you. Kia ora koutou. Thank you.
So we need to ensure that we're culturally safe so we can teach our whānau. Thanks, boy. That's fine. So, on my journey of doing all of this, I actually came across an app, Ake Ake. And there's a couple of apps that are out there that can actually help you with translating. Recently, my son broke his jaw and ended up having to be transferred out of the Bay of Plenty DHB. He was fine while we were here, because the nurses, while they didn't have extensive reo, they had enough reo to speak to him. They asked him in Māori what his pain scale was. They said morena. So, but when we got transferred out and I got to another hospital, sadly, when we asked where was the cultural services, the reply I got was, oh, the Maoris don't work on the weekend. The Maoris ain't here to help you. You just got to listen to us. And I was kind of taken back a bit. But sadly, that's what happens. So you end up having to advocate and you have to talk. So luckily with having to do this presentation, I'd actually been sent this app. So I actually showed the nursing staff this app, and you can go on and it actually teaches you how to pronounce words properly. My kids have got really long, bit technical names. One of them is called Te Iho Naro Kaikupu, which I know is really long and really hard to say. But instead of people pronouncing his full name, they would use his Pākehā name, his non-Māori name in the middle of his name. So they'd go to that first instead of just attempting to say the name or just asking. If you don't know, just ask. That's what I always say to people. If I go into and it's a non-Māori patient and I'm not too sure how to say them, whether it's Pacifica or whomever, I ask them, how do I say your name? Because if you can't get a patient's name right, you kind of get to the point where you go, huh? And this is coming from a whānau member's perspective. So first and foremost, what I'm saying is, as a Māori person, I'm not asking you to be fluent. I'm just asking to start with the basics and get our names right first, because in all our names, there's mana. Every person that's sitting in here, your name was given to you for a reason. I gave my kids really specific names because it represents who they are and where they come from. And I want them to be strong in who they are. So with this app here, it's really helpful. It goes on to telling you, if you're really unsure about some of the cultural practices, pōhiri, karakia, prayer, going to the marae, what mana whenua is, how to speak, how to engage in a Māori hui, it's actually really good. And then the picture on our right, I'm sure everybody would have seen this, korowai orana, it's the Māori strategic plan. Sadly, it's a beautiful plan, but it's only the beginning. We have it, but is it being used to its full effects within the DHBs, within our health sectors? Is it actually being used to its full effect? Sadly, in my study, I'm thinking to myself, no. It's there, but it's not really being used. So as As I come to a close today, I just wanted to keep it really short and succinct. My wero, my tono to everybody here is today is language is a barrier, but language also can be healing. If we can get our language right that we use with our people, ahakoa, no matter where they come from, if we can get our language right to fit our people for health literacy, we're halfway there to helping to heal them. Nō reira, tēnā koutou, tēnā koutou, tēnā tātou katoa. Kia ora whānau.